Dr. Charles Mok with Allure Medical, and I want to ask some common questions that are coming up. One of the questions is, where do I get trusted or reliable source? It's the CDC, Center for Disease Control. That's what I would recommend. So if you type in your Google search and put in the letter CDC, you'll get the CDC website, which is a government-funded research group. And they really are the ones that we're relying on to give us accurate information. They're collecting it, and hospitals already know how to get information to them. So they're the best collector of data. And they'll also give you the current guidelines. And this is March 21st that I'm recording this, so these things actually would change. They've changed since last week. One question I heard was, what's with the 6-foot deal? Well, there's 3 ways that you could pick up a virus from another person, and in this case, the COVID virus. There's actually multiple ways you pick up a virus, but this one appears to be 3 common ways. Number 1 is through their coughing, so direct droplet control. So if somebody has a cold and they have COVID virus and they cough, that spittle could actually get on your face, or you could touch your eye and get into your mucous membranes. You can get the virus, and it's contagious in that way. And that's why they recommend, if you have the COVID, you just wear a regular surgical mask and be out in public, because that way you don't cough on people. Okay, the masks that we use for healthcare workers are called P95 masks, and that's to keep you from inhaling it, which is the second way you can get COVID. The 6-foot rule refers to an area about 6 foot around the person who is sick, that's been coughing and stuff, or they're sick and they're just breathing it out. Is about 6 foot. Outside of 6 foot, you're pretty safe, and it's about 15 minutes. So being in their close presence for 15 minutes would put you at a higher risk. So if somebody was sick and they didn't know it yet, and they were starting to get symptoms, or they're maybe going to the bathroom and coughing and coming back out, they could have the virus, and it would be in their area. So if you're in their region for more than 15 minutes and they wind up having been sick, then you will have the virus exposure. Okay, at my practice, I've been really doing a lot of war room work, trying to control our business and figure out what we're going to do, because we have had some locations have to close because of state mandates. And I've just watched my watch when I walk into a room, and in 15 minutes I'm out. I'm talking to our staff about kind of limiting their time with each other, not aggregating the hallways, and that's what they're referring about social distancing. Okay, so that's a 6 foot. And the other one is surfaces. It appears to live on surfaces for several days, but it's easily killed by any EPA certified disinfectant. So what is an EPA certified disinfectant? Anything at your local store that's for sale is EPA certified as a disinfectant, because the virus is easy to kill. So you just wipe things down. So hand washing with 20 seconds with soap, or using an alcohol-based gel that is at least 60% alcohol. The common household disinfectants. Try to socially distance, like not be in a close proximity with somebody that's not in your household for more than 15 minutes. And if you're sick, stay home. Now, what happens if you're in a situation where you have to be in close proximity of people? Well, you have a higher risk of getting the virus. One of my friends in the ER, I was talking to her, and they were instructed they're going to work even with the exposure, obviously, because they got to be in the front lines, but they're sick, they have to go home not to transmit it to other people. And that's why stay home if you're sick. If you're sick, stay away from people and just isolate yourself. Another question I heard is, how do I know if the symptoms are related to COVID? Is it a fever, a cough, is it a cold? Well, it does exist in the stool, so it could cause some diarrheal illness, we think. Nobody's really been testing that, but that's not the primary mode. It is a chest cold. So the COVID virus attacks to the pneumocyte, and it alters what's called surfactant, which is like a lubricant inside our lungs, and the lungs fill up with fluid, and that's why you get the coughing. Now, can it cause a cough or can it cause a runny nose or sore throat? It looks like it's a very low probability. Scratchy, watery eyes, and that's probably another virus. But if you have a cough and a fever, or cough and a fever, you should consider that you potentially have COVID and definitely stay home. If you have a runny nose or scratchy eyes, you probably don't have it. But I would suggest in these times that if you have a cold, just stay home unless you're in a critical operations job. So runny nose is not a sign. Allergies would be distinguished by not making you cough, but if your allergies make you cough and now you're coughing, you really don't know. So we're just suggesting that people stay home, because we really have to control this thing because there's not currently an effective vaccine or a clear drug that works for it. There's testing things, but unlike the flu, we've had drugs for a long time that reverse the flu, and we have immunizations for the flu. We don't for this as of yet. So those are common questions I'm hearing. When do you go back to work when you have been sick? The CDC is recommending two different strategies. One is called a test-based strategy, and one is just a time-based strategy. So the time-based strategy we use mostly, you probably should not be retesting yourself if you had COVID because there's not enough test kits right now, but I think in a month or so that will change. So strategy number one, you get sick, and that is day one, okay? And you cannot go back to work until it's been 7 full days, until it's been 3 full days since you've had a fever, and until your cough is gone. So if day one you get sick, and you're coughing and you have a fever and you're better the next day, you can return to work in 7 days. If on day 6 you still have a fever, you have to wait till 3 days afterwards. And the cough's got to be gone before you go back to work. So those are the 3 things. Now the test-based strategy would be after your symptoms are gone, you get 2 negative tests, 24 hours apart. What happens if you have COVID virus and you're not sick? Then it's just 7 days. So if you just go get tested and you're not sick at all, then you wait 7 days and you go back to work. The 14 days, they've removed that. Now, one thing the CDC hasn't specifically guided us on is what happens if you just had an exposure. So we're gonna talk about the exposure a little bit. So as far as we know, exposure is gonna be most significantly contagious when the person is sick. So if you're around somebody that's not sick and they go home and the next morning they have a fever and a cough, we don't think you were exposed, so your risk of getting it is very low from that person because they weren't sick at the time, so they were not aerosolizing it. And that's the best information we have right now. We have medical practice, we have to decide who's working and stuff, and if we have somebody that's at all sick, we're just being very aggressive at looking for it, so we're doing a self-screening in the office. When people come into work, we're checking them for a fever and a cough and symptoms, and they had any recent travel, and obviously doing that with our patients as well. Let's go back to the masks again. There's 2 types of masks in general. There's a lot of masks, obviously, but there's 2 types of masks. You have the regular surgical mask that you might see your doctor wear if you're getting a procedure done, and that's designed to keep the person from coughing in your face, like getting this droplets to you. So if somebody does coughing and they're around other people, they should wear a mask, and that'll keep the liquids from going out. Now, there's something called a P95 mask. You've probably heard about that, and that's one for healthcare workers or people in the front lines that they're wearing them to keep inhalation from coming in. Okay, so the P95 mask should be reserved for people that are in healthcare currently, and particularly healthcare in hospitals or disaster areas. A lot of people are buying them for different things. Like I've heard that maybe some of the food supply places are wearing them so they don't get inhalation like a grocery store, so that might make sense. And we'll get recommendations as more masks are available. But the idea is that if you see somebody with a mask on, the round one, the P95 mask, you can look that up, but it's a mask that prevents the person from getting sick. And the regular surgical mask that goes around their ears and it's got kind of a rectangular shape, that's designed, that's probably either they are sick or they just don't understand the purpose of the mask and are wearing them. The CDC recommends not wearing the regular surgical masks to prevent disease because you really don't, those things get dirty after time. They actually have germs, so I would not wear those. So what do you do if somebody in your family is homesick and they're adult, and how do you keep from getting it? Well, it's going to be, again, some isolation. So that adult would maybe sleep in a different room. When they're going to have dinner, they would go and prepare food and then clean up after themselves, wipe down the refrigerator and anything they touched with Lysol or similar and disinfect it. You could have do the same thing yourself when you go into the same room, re-clean it yourself with disinfectant, and that way you've kind of double-checked anything you're going to touch, you've disinfected. Don't spend more than 15 minutes in their presence within 6 feet, and at that time have them wear a mask so they don't cough on you. And that would be the best way to keep your family, this from spreading through your family. The exact rate of contagiousness we don't know, but the good example we have is from the Diamond Princess cruise ship. And they had 20% of the passengers, 20% of the people on the boat caught the disease. And of that, 0.8% of them died. And they were all, 100% of them were over 70 years old. So it's particularly at risk for people who are older or have other health conditions. You've heard this. So if someone in your family has significant disease, they really should have some significant isolation. You should be washing your hands very frequently before you go in their presence. Make sure you wipe everything down that you're touching, and avoid some isolation. If you're sick and you have an elderly person in your home, you might find another place to stay at for that period of time while you're kind of getting over the cold, getting over the coronavirus or getting over the COVID virus.